Sciatic pain is very common during pregnancy. So basic exercises that you can do at home if you are struggling with sciatic pain. You may have seen videos on strengthen your glutes, strengthen your core, and during pregnancy your core is already weakened. Sciatic pain is compressing on the sciatic nerve. Is relieve that as much as possible by building your glutes and building muscle around that before pregnancy and before the pain begins. That will help support the structure. The muscle is pressing in on the nerve, so what we need to do to relieve it, sometimes it's a very quick fix. These exercises are something that I do with clients within. I'm going to give you a brief overview today as to some of the exercises that I cover to make sure that you're relieving the tension on this nerve. I'm going to start off with a pelvic tilt from a standing position, and that is purely for you to get your core slightly engaged, your pelvis back in line, because during your pregnancy your pelvis and your pubis symphysis is a little bit wider than normal and there is a gap. Tuck the tailbone underneath your rib cage. You want to stack it. So during pregnancy this will look like you are almost pushing your bump up, and that's okay. So on the push up, you're going to exhale and draw your breath in around your bump. It's also called trans-abdominal breathing during pregnancy, like you're giving baby a hug in the womb, and you're going to exhale and contract it and relax again. Let your tailbone sink back, let your back relax, and then you're going to tuck it again. So when you feel it during the day triggering, remember to tuck, and you're essentially lifting the bump. What you might want to do is hold on to something beside you. So I'm using a squat rack. You can use a door frame, a wall, something stable, because you will be moving to one leg. So what you want to do is bring your knee up as high as is comfortable and tuck the tailbone again. So you're squeezing the glute underneath the tailbone, and this will naturally just bring the leg up a little bit higher so that you get a little bit of a more stretch on it. Normally what you'd be recommending for the glute is that you do a knee hug. During pregnancy that is almost impossible. So you're going to tuck, you're going to squeeze the glute and keep the leg upright. I'm going to hold on just as an example. You're going to bring the leg just out and in front of the body, just to let it open up a little bit more. Let your adductor open up. And it's a movement we don't actually do a lot during pregnancy, is the lateral one. You want to control the movement as well. You want to control as it moves up and back across the body, up onto your tippy toes, as high as you can, to do your pelvic tilt again. You're going to get your pelvis a slight bit more forward than you will with your feet flat on the ground. Again, hold on to something up on your tippy toes, relax back down. You're in your superwoman pose with your hands around your waist. Best friend during pregnancy and during your labour and birthing is a sumo squat. Feet out nice and wide. I will say the stretch for your sciatic on this one and preparing for birth is amazing. It is such a good squat position. Toes pointing outwards, and from here, hands in your superwoman pose, you're going to squat down just as far as you can. And you're going to push back up. Now, as you push up, that's when you're going to exhale. So big exhale up and gentle back down into the stretch. When you're at the bottom, do let your pelvic floor relax. Not something you'll hear too often do an exercise, but do let it relax, and then squeeze as you come up, which you very well might. You can alternatively do a deeper squat known as the monkey squat, and I would recommend that you're holding on to something. So with regards to the monkey squat, you're coming down nice and low and you can rock from side to side. In your second or third trimester, Lying down flat is definitely a lot more uncomfortable. Third trimester, it's not possible at all for safety reasons. So what you want to do is come down, feet hip width apart on the floor. You're going to bring your knee up onto the opposite leg and you're going to push on your knee that is upright. Exhale again. You can do that one as often or as little as you need to, but that is a key one to keeping tension down on the glute area, especially with sciatic pain. I hope today helped you. If you have any questions about pregnancy pain or you're struggling with it, please feel free to leave a comment below or drop me a message.